kind of hanging.
And welcome to April's Medical Monday, which kind of surprises us. The month started on a Monday, so it kind of, this time Friday and Thursday was after Medical Monday. I mean, it was before Medical Monday. So we want to welcome you today. And our speakers today are from our Community Health Department, which is actually part of Community Engagement. And we have Andrew Hoover and Ashley Shepard. And we have our newest member who just joined our team. Stand up, Liz.
Today.
And Liz is the newest member of our Community Health Department. And I noticed a lot of people already knew Liz from her working from Medical Fitness. So welcome, Liz. And then Jesse, Katie, and Nathan are here. So we want to thank you for being with us today. And without further ado, I'm turning it over to the community health people.
All right. Hi, everybody. Hello.
This is how our job is.
All right. So you guys have seen us in the back. As Sherry mentioned, we work very closely with the community engagement team. Technically, it's like community health and engagement. It's really the same thing, just a little bit of separate jobs and separate accounts for the money. So the community health team is actually 100% funded by Health First Indiana, which is a public health grant. All 92 counties in Indiana were given funds to address health needs in the community, and it was given to local health departments. And every health department chose to do it differently. And our health department chose that, hey, that's a lot of work to take on, so we're going to add on some partners. So we are grant funded, at least myself, Ashley, and Liz, and then Jess a little bit. So of course she's over engagement as well. So all of our work is grant funded. We're not actually charging the hospital anything. So awesome stuff. We're very thankful to Health First Indiana and to the Wayne County Health Department for that. So our team, you know a lot of us already. I'm going to have them stand. I know they just stood, but we're going to have them stand again. So our director is Jess Sheebish. So, and I'm going to kind of explain a little bit, because the cool part about our team is it's very unique. So Jess is our director of health, community health and engagement. She's also over athletic training and fitness as well at the hospital. She's a licensed clinical social worker, so she brings a lot of mental health experience in. Myself, I can talk. That's about my only skill. But I'm a certified community health worker, and then I'm also a child passenger safety tech, which means I know all about car seats and work a lot with kids. And as of next week, Ashley and Liz will both be certified child techs as well. I'll hand it off to Ashley, but first I'll give a shout out to Liz. I can make you stand up again. Liz Gwynn, our newest community health worker. And she is also a certified exercise physiologist. Is that how you say that? Yes. Okay, which means she knows how to like work out and teach you the fitness, which is great because we really need that on our team. And then our medical expert is Ashley.
I've met most of you here. My name is Ashley. I am a medical assistant and a certified health worker, community health worker, and I have been in the medical.
You gotta have your microphone closer to your mouth.
Can you not hear me? No, you can hear me. I have been in the medical field for about 20 years. So I specialized in GI, liver disease, family health, and then mental health as well.
All right, so we mentioned we're grant funded. So that means there's only certain areas that we're supposed to work in, and that's what's outlined by our grant. We're going to kind of dive into those. So the three main topics are tobacco and vaping prevention and cessation, chronic disease prevention, and trauma and injury prevention. So we're going to kind of speed through this because then we're going to get to our actual presentation for you as well. So the first one, I will hand it off to you because you are all about freedom and tobacco.
So we just recently started Freedom from Smoking courses. Those are 7-week courses with 8 sessions. Those are free to everybody. It is evidence-based to help people quit smoking, vaping, chewing, the little Zen packs, snuff, things like that. All materials are free. It is incentive-driven, so you do get incentives for coming. And it's a support group styled session. You do not have to have referrals. You don't even have to be a patient of Reid. If that is something that you guys are interested in, you can go to that website there, reidhealth.org/quit, or you can call one of us and we can help you get registered for that. And then along with that, we do tobacco and vaping prevention and cessation. Andrew's really been working on that in the schools, so I'll let him talk a little bit more about that.
Yeah, so we do a program called Catch My Breath, which is for children's 5 through 12. It's a vaping cessation program that's fun for kids and a cool way to learn. And we're trying to team up with local schools and nonprofits. So we have a couple things in the pipeline for this summer with some child groups, we're hoping. We got some meetings on the way. But most recently, I was inside Northeastern schools about a week ago and trained 5 teachers for their middle school and high school to where hopefully they'll be bringing this program in and getting our kids to not vape, because vaping has totally overswept smoking now. A lot of people aren't even smoking tobacco as much anymore. A lot of people are moving towards vaping because it's the quote-unquote healthier option, but it's not. We could have a whole presentation on that. So, but we're leading some community trainings on that as well with some of our community partners as well in the near future. Chronic disease prevention. We're doing a lot here with providing education on heart disease, diabetes, and other chronic diseases, teaching healthy eating and promoting physical activity, which is something we're going to do with you guys today. We're going to give you guys a little presentation on healthy eating and physical activity here in a minute. And also offering free blood pressure and glucose checks at community events. So a lot of people don't know their blood pressures. They don't know what that means. They don't know their glucose. And we're able to go into spaces and provide that completely free. Ashley can provide that, which is a great thing because sometimes we go places such as food pantries and things like that where people aren't aware that they have high blood pressure, so we're able to take it, educate them, and hopefully get them the resources that they need. Trauma and injury prevention is another one. So I mentioned that I'm a car seat technician. Ashley and Liz will be getting theirs next week. It's about a week-long training to become a car seat technician. And there's less than about 10 of them in Richmond. So it'll be awesome when we get 2 more on the streets. So we're able to check car seats and their safety for community members. About 46% of car seats on the road are installed incorrectly, whether it's installed incorrectly using the wrong car seat. So we're able to teach that and help people, teaching safe sleep for our infants, and also providing car seats and pack and plays to people that need them for having those, and also fall prevention in seniors. I know we talk fall prevention at Medical Mondays a lot, so that's one thing that we're working on, because one of the biggest things that brings people into our emergency departments for seniors is falls. Falls are very, very big. So ways that we can help with those. Also distracted driving in our teens. And then soon, if this weather ever gets nicer, we're going to be talking bicycle safety for adults and children. But the weather keeps getting dicey, so people are putting the bikes in and out. So we'll get there. And then lastly, you're going to see us out and about. Our main job is to be out. If Jess told us the other day, if you're at your desk, you're not working hard enough. Our job is not to be at our desk. Our job is to be out in the community, talking to people, working with people. So we are mobile. We offer what we call workshops. A lot of our things are what can we teach you in the 5 minutes that we have you in front of us at an event. So we've already been busy going to community events, nonprofits, local employers, health fairs. And my goal is this summer when you go to Levi Coffin Days, all the other county holidays and all those county fairs, you're going to see us at all of those, hopefully, out there educating people and giving them the resources that they need. Yep, and we're also actually teaming up at the Senior Center for something kind of similar to this almost. We're actually going to leave and go straight to that after, called Monday Mashup. So if you're a part of the Senior Center, you should check that out. We're doing, it's like 6 weeks, and this is week 2. Where we are providing education like you get at Medical Monday, and then immediately following is some kind of physical activity that relates to that. So last week we talked about blood pressure and maintaining your blood pressure, and then immediately after, Karen from the Senior Center led chair yoga on how to lower your blood pressure. So today we're talking about heart disease, and then they're having an exercise with that as well. So definitely take part in that as well. And then lastly, if you ever have questions, reach out to us. If you don't have our information, ask Sherry. She can definitely get you in control with us, or I'd be happy to give anybody our business cards. We are supposed to be mobile and there for you. We have cell phones, so if we're not at our desk, we're going to answer that phone and talk to you. At the end of the day, if you have a question about the hospital, we can navigate you to that. If it's a billing question and we don't know the answer, we're going to find the answer for you and connect you to somebody at the end of the day.
I have a question.
Yeah.
Children's car seats in my car. Where can I go to have it checked that I have them installed correctly?
Me. I will give you a business card at the end of the presentation. Does that sound good?
Yes. Somebody said some of the fire stations do it too.
So that, to my knowledge, there's not a firefighter in Richmond that is certified. At least if they are, they haven't came to any meetings. But I know that Richmond Police Department has one certified tech that we work with, Detective Ridgway. So some fire departments can, but as far as like certified techs, I don't know of any there. So, but I can give you my card at the end. We offer that completely free as well. So it just takes about 30, 40 minutes to do a car seat check. So we take the seat out completely, look at it, all the fun stuff, show you how to put it back in. So it's good stuff.
Can I ask one more quick question?
Yeah.
How long do you keep them backward facing? Because I always thought it was a year, but then I heard.
So really it's kind of a trick question. Really depends on the car seat. So you should always check your car seat for what that says. Every car seat's different, and it really goes by their height and their weight ultimately. So really depends on the car seat. So people always ask, they're laughing because they know I love car seats. So
It's like at least they're car seat questions.
at the end of the day, people always ask like, what's the best car seat? The best car seat is the car seat that you can put in every time, no questions asked, the car seat that fits your child, and the car seat that fits in your car. So definitely check the car seat. It'll tell you like the weight requirements, because ultimately if it's best practice, you need to follow what the seat says, because that's what the seat's been tested. So if it says turn them around at, I'm just throwing out a weight here, say it's like 50 pounds at least, but sometimes it's very, I could get into this. Sometimes that forward facing and rear facing are the same numbers, or, you know, like, yeah. So one of the things we're going to talk about today is healthy eating. So this is a big topic that we talk about because when we eat healthy and we live a healthy lifestyle, it is going to help us overall with our chronic health and all of the different things. So healthy eating is something that we always hear a lot about, but what all does it affect? So I thought this graphic was really cool because the quick answer is basically everything. As you can see, by eating healthier, you can lower your overall risk of chronic diseases like heart disease, type 2 diabetes, and even some cancers. I know those things you guys hear a lot about at Medical Mondays. Overall, it'll help boost your overall immunity to keep you safer from nasty germs like flu seasons and other viral infections. It also helps maintain your weight and gives you more energy to complete your daily tasks. So that's some of the best things about eating healthy. And we're going to kind of dive into eating healthy. So there are some simple ways to track eating healthy. And how many people in here remember the food pyramid? We've all seen and heard the food pyramid. So the food pyramid is not really much of a thing anymore. What we now preach is kind of My Plate. My Plate was replaced the food pyramid that came out in 1992. And it's a modern way to kind of teach people to eat better every day. It's easy to use, it's customizable, based on science and an overall great way to enjoy healthier eating. So My Plate is kind of nicer, and we'll kind of dive into this a little bit more of what each of these mean. But the food pyramid kind of confused people because it was kind of like a tiered base, and it was like, this one's more important than this one, and that's not exactly what it meant. So My Plate kind of shows you your portions. So we're going to kind of dive into that. One really cool thing, and I believe I put there's a sticker on each of your tables for My Plate as well. But you can actually go to myplate.gov, completely free. It's a government website through the USDA. And they actually have customizable things on there where you can customize recipes and a diet plan for you, which obviously we're going to get to this later, but talk to your physician before you do that. But it's a really cool program where you can say, if I want to lose weight or I just want to maintain my weight or eat healthier, they can create a whole plan for you on this website, which is really, really cool. So now we're going to kind of just dive into each of those My Plate topics and talk about what the food we're putting in our bodies does for us, okay? So overall, eating whole fruits and drinking 100% fruit juice is a great way to start your health journey. There's an array of different fruits and ways to eat them. You can eat them fresh, canned, frozen, mashed, and even cooked. So most fruits are going to be low in fat, sodium, and calories, and fruits do not have cholesterol. So fruits also have many nutrients that our body needs that we won't always get enough of. Things like potassium, fiber, vitamin C, and folate. Diets rich in potassium can help you maintain a healthy blood pressure. So fruits that have so that we have good potassium, we can eat fruits like bananas, prunes, prune juice, dried peaches, apricots, and things like that. Also, dietary fiber from fruits can help lower your blood cholesterol levels. And then also, lastly, your vitamin C, which is important for the growth and repair of all of our body tissues. So it can help heal cuts and wounds and keep your teeth and gums good as well. Any questions there? Fruits? This is pretty straightforward. So vegetables, this is my least favorite part of this whole presentation. We're just being honest, okay? So eating vegetables can have some benefits that we see from fruits as well. People who eat vegetables are likely to have a reduced risk of some diseases. Vegetables provide nutrients that are vital for the health and patience of the body. Most vegetables are naturally low in fat and calories. However, sauces and seasonings that we add can add fat and calories. So what I'm thinking of this is, and I meant to say this before, is that when you're watching this presentation, I want to say take it with a grain of salt. That's not the best thing to say when we're talking about eating healthy. But remember that it's kind of a guide, and you got to talk to your doctor about it too. Because when I saw this and it talks about sauces and seasonings, I like broccoli and cauliflower with a little bit of butter. Okay. So, but if you add that, it's taking away some of that stuff. So keep that in mind when you're adding seasonings and sauces to some of these items that we're going to read about today. So you'll see trends in vegetables that include sources like potassium, dietary fiber, folate, vitamins A and C. Some of the veggies high in potassium can include sweet potatoes, white beans, tomato products like paste, sauce, or juice, soybeans, spinach, and lentils. And then vitamin A in many vegetables can keep your eyes and skin healthy and also helps protect yourself against some of those nasty infections that we're seeing, especially around this time of the year. So grains, this is a big one. So grains have two subgroups, whole grains and refined grains. And I'll be honest, before this presentation, I was like, what's the difference? Okay, so I'm going to try to explain the difference to you, okay? So whole grains have the entire grain kernel, which includes brawn, germ, and endosperm. Some whole grains, examples, this is where it really helps me, because you use those big science words, none of us know what that means. So let's break it down. What is that? That is your cracked wheat, oatmeal, and brown rice, things like that. Your refined grains have been milled. This is a process that basically removes that brawn and germ. This is done to give these grains a finer texture and improve their shelf life. What are they? Good question. White flour, corn grits, white bread, and white rice. So your refined grains should be enriched. So you can check your ingredient lists on your refined grain products. That word enriched should appear in that grain name to try to tell if you're getting enough of that enriched. Some of your food products are made from mixtures of whole grains and refined grains. Only foods that are made from 100% whole grains are considered that whole grain food. So that's going to be on your packaging as well. So kind of looking at what you're buying can be important. And eating grains can help prevent heart disease with some of the same nutrients as our fruits and vegetables, but can also help build metabolism as well as give energy and strengthen our bones and muscles. So it's kind of all working together. Now this is my favorite topic. All right, protein foods. This includes all of our foods made from seafood, meat, poultry, and eggs, beans, peas, and lentils. Notice some of those are in the same topic. And then also nuts, seeds, and soy products. Beans, peas, and lentils are also part of the vegetable group. So to learn more about beans, peas, and lentils, they actually have a whole page of that on the myplate.gov site if you're interested in that, because it kind of plays in both parts. So each of our variety of protein foods help our body in different ways. So meat and poultry choices, you might be thinking about what should we look at when we look at our meat and poultry. So your meat and poultry choices should be a lean or low fat, something like a 93% lean ground beef, pork loins, or skinless chicken breasts. When you're choosing seafood options, it's better to choose foods that are higher in healthy fatty acids, called those omega-3s that we hear about. And we got some big words here. But it's also good to look at things such as like salmon, anchovies, trout, things like that. If you are a vegetarian or a vegan, the advice to eat meat, poultry, and seafood does not apply to you. Vegetarian proteins can include options like beans, peas, lentils, things like that.
And I'll just add that if you are diabetic or pre-diabetic, your MyPlate is actually going to look different. So you have to watch your sugars, you have to watch your carbs. So this is all for a normal diet. If you are diabetic or pre-diabetic, you want to follow up with your family doctor and they will help you come up with a meal plan. And if you need further assistance, they can refer you to like a nutritionist or like our diabetic nutrition education department. So PSA. This is not for everybody, most people.
My goodness.
And then also for whole grains, if you're looking on your labels, that will be the first ingredient listed if it is in fact a true whole grain food. It'll say whole grain. Some things say whole grain and they're not, so don't be misguided, read your nutrition label.
So our proteins function as building blocks for our bones, our muscles, our cartilage, our skin, and our blood. They're also building blocks for our enzymes, our hormones, our vitamins, and more. And the cool thing is, the thing that we are doing right, many Americans get the right amount of protein needed for their meat, poultry, and eggs. So that's a good sign. A lot of times we hear Americans are unhealthy. We're at least getting what we should need as far as meat, poultry, and eggs, because those are the things we like to eat. However, a lot of us do not meet the recommendations for seafood or nuts, seeds, and soy products. Meeting these can help increase the amount of important nutrients that our body needs, like our unsaturated fats, dietary fiber, and vitamin D. So keep that in mind as you are looking at your proteins. Things like seafood, nuts, seeds, and soy products are things that we're not getting enough of typically in America. So dairy, about 90% of Americans do not get enough dairy. Most people would benefit from getting more fat-free or low-fat dairy. This can come from things such as milk, yogurt, or even cheese. It can also come from lactose-free milk or fortified soy milk or yogurt for those that can't have regular milk. Eating and drinking dairy products offers health benefits like, you guys guess some of these? We always hear about these. Like building and maintaining strong bones. Dairy group products are able to provide nutrients that are vital for the health and maintenance of the body. And ultimately, these nutrients include calcium, potassium, vitamin D, and protein. Calcium from milk is where we often hear that it helps build your strong bones. This is extremely beneficial as we grow older and maintain our bone strength. It helps prevent the start of osteoporosis, which is a bone disease that can start to weaken your bones and make them more likely to break and have fractures. This condition is especially prevalent in older people, so start to watch out for that, and the more you drink milk, the more it can help prevent. And then lastly, what goes well with healthy eating is physical activity. So physical activity is very important to aspect to mix in with our healthy eating. Combining it can help control your overall weight management, your heart health, and your mental function. Physical activity has things that not only help you immediately, but also help you long term as well. It can help you feel better, function better, and sleep better, which we could dive into a whole thing on sleep. We talk about sleep at Medical Mondays, don't we? Sleep controls so much about your body. And if you have a good workout, it's going to help you with that. And one of the things that we try to tell people, when you're thinking about working out, and Liz can probably talk for days about this, but working out can seem very intimidating, especially like going to a gym and doing things like that. But even just simple commercial breaks when you're watching TV can go a long way. So if you're watching an hour-long television program, there's probably 30 minutes of commercials. Every time there's a commercial break, get up and do some chair squats, do some jumping jacks, walk in place, march in place, do something to get your body active. Sit back down, turn the TV back on, and then commercial break, get up, do something again. By the end of the week, you'll have a lot of exercise. So it can be as simple as that. So as Ashley mentioned, the last part is what's right for me. So before creating any new health plan, you should always talk to your doctor or your primary care provider. They're going to know what's right for you. There may be foods, like Ashley said, that you can and cannot have. Maybe some foods that might be better for you than others. So definitely talk to your provider if you're interested in trying to change up your diet or create something for yourself. as well as your intensive physical activity. If you're trying to go out here and start running a marathon tomorrow, talk to your doctor first, okay? Make sure that what you're doing is right for you. And then ultimately, if you are interested in working on your fitness, Reid does have fitness classes as well. If that's something that you are worried about, maybe working out at home alone or different things that you might be limited to, Reid can help you with that as well. You can just talk to your doctor about that as well. So, any questions? Take it easy.
Did I hear you right when you said Americans, that there's about 90% of us that don't do dairy?
They're not getting enough dairy, about 90%.
Is that divided like between children and adults, or just?
The stat just said 90%, and that came from my plate.
Push it so much.
Yeah, and I feel like they used to push it a little bit harder. I know when I was in school, I remember like the celebrities with like the little mustache and everything, but I feel like you don't see it as much anymore. I know I personally probably don't get my intake that I probably should, but I feel like it kind of depends on the household too. Some people don't drink like that 100% whole milks now, so they're looking at like the low-fat milks or soda or the soy milks, things like that. So really just depends.
It's probably because we eat out so much. Eat out, you don't really know.
Yeah.
Brownberry bread has nuts in it, and they're nuts so big that you can actually chew the nut.
What is it?
Brownberry bread. And the other thing that I wanted to say, Jimmy Dean's egg in a little box has you remember what I said? A teaspoon and a half of salt per box. That's a lot.
All right. And then obviously too, if you have questions too, like I said, about like labels, we're going to dive into that here. So I apologize that we did not dive into reading labels. But if you ever have questions about labels too, asking your physician as well. But then Reid also has a really awesome diabetes and nutrition education team, which I believe we hear from them typically here as well. But they would always be happy. They have classes as well. If you're really wanting to learn more about your food labels and what you're putting into your body, especially if you're diabetic, and wanting to know what you should eat and healthy recipes, our D&E team does an amazing job at helping people understand diabetes and what they can and can't eat and things like that.
Or you can come visit us at the Senior Recreation Center, because that'll be the topic in like 2 weeks, is reading nutrition labels. I think they can hear me. Everybody hear me? Yeah. Oh, 2 weeks, we will be going over nutrition labels and how to read those at the Senior Recreation Center, if you guys are interested in coming to that. We dive more in depth into these topics.
What time are you down there?
It's 2:30 to 3:30 on Mondays. It's 3 6-week programs. This is week 2 of the first one. The next 6 weeks will start in, I believe, July, and then we'll do a fall session as well.
Nope.
You can pick and choose which ones you want to come to. Do they have to pay?
I don't know.
I don't know if you we'll find out today if you have to like pay the membership for the monthly or whatever. I'm not sure what it costs, but we'll find that out today and let you guys know. $25 for a year? Yeah. So then you have access to all the things in it. It's a cool place. They have all you.
So any other questions about like our department or anything else that we talked about today? Yes, Sherry?
So we talked about you going out in the community. So if you had a referral or you have like a church group that you would like you guys to present at?
Absolutely. So if you are part of any groups that would like to hear from a topic, so we can present on topics like this, we can present on blood pressure, we can come and just take blood pressures, glucose checks. Maybe it's coming and talking about fitness, talking about car seats, talking about safe sleep, anything. Fall prevention. We'd be happy to come to your group. Just let me know at the end. I can give you my business card. We can set something up. We've spoken to church groups. We've spoken to Lions Club. We did the Rotary Club last week. I think Kiwanis wants us to come speak. We've spoken at schools, things like that. We're always welcome to come out and talk about an array of topics. Our main job is to educate people. We are not exactly the people that are in charge of helping your health. We typically don't work one-on-one with patients. It's more just how can we group educate people. But obviously if you have a one-on-one question, we can help you. A lot of our car seat things, like I I'm gonna give somebody over there my card for car seats. Those are a lot of one-on-one things we do. So at the end of the day, there's really no wrong question for our department. We're gonna find you an answer. We're never gonna tell you, hey, this isn't something we do, bye. We're gonna get you to that right person one way or another, or Jess will fire us all if we did that, so. So, and the one thing about too, we mentioned that community health worker certification that we all have. Sherry was actually, I think, probably the first community health worker at Reid. I'm gonna give her some shots for that. So we'll shout out. I think Nathan and I were next, and then Jess, and Ashley has hers. So we're all community health workers, and really what the cool thing about that is it really dives into understanding your community and the needs of your community. So if you ever have questions, any of us would be more than happy to help you as well. Community health workers are a really cool part of kind of understanding your community and getting involved in your community from a healthcare standpoint. And I think that's the really cool part about our department is we're kind of in the community in ways that Reid hasn't been, other than Sherry. Sherry's got backup now, which is great. She's got more than just herself out there on the street talking to people. So
We're a trusted community source.
yes, a trusted community source. That's a good way to put it. Am I leaving anything out? Any other questions?
Did you?
No? Okay. Well, this is awkward, so I'm going to give the microphone back to Sherry. I think you guys are out of here early today.
Next month, we're going to be on women's health. And so we are excited to have Amber Burns here, who will discuss women's health.
Thank you.